empowered. Be strong. Take charge. Speak life. Live life abundantly. Get with it now. You are now entering the chat room. Health Chat with Coach Jean, that is, where we debate, debunk, educate, empower, impart, and raise awareness on all things related to health, healing, and holistic well-being, body, mind, and spirit. Let's go.
Greetings, everyone. What's going on, everybody? It's that time for another episode of Health Chat with Coach Jean. And this is your girl, Nurse Coach Jean Turner, a.k.a. Miss Fit Foxy 50 and beyond. How is everybody doing this evening? So let's see. We got the ATL in the house. We got the Carolinas in the house. We got Alabama in the house. New York is in the house. California is in the house. South Africa's in the house. Jamaica's in the house. Hey, we got social media in the house. Hey, we're all in the house on tonight. So welcome. Thank you all for being here in the house, in the chat room, live streaming on Spreaker.com. And you know, we are now available on Pray.com, Apple, iHeart, Spotify, and Spreaker podcast. So listen, tell a friend, tell a foe. Coach Jean is on right now, live streaming via Positive Power XXI Radio. Hey, if you got a question or a comment about tonight's show, join the chat room in real time. Go ahead and head on over to my Facebook page, Health Chat with Coach Jean. Go over to IG if you're on Instagram, to my Health Chat with Coach Jean page. And if you like to tweet, you a tweeter, hey, tweet your comments or questions on Twitter at @chat_coach. And so, yes, it is October 1st. Can you believe it? And tonight here in the chat room, we're going to have a discussion that will bring a deeper awareness to the other side of a cancer diagnosis. And let me first say that, yes, I do acknowledge that it is Breast Cancer Awareness Month, but here in the chat room, we will be just referring to cancer. And this is no disrespect to anybody. I salute all warriors. I salute all cancer conquerors. I salute all of you who are currently in the battle. I salute every caregiver. But hey, cancer is something that we need to bring full, even greater awareness. There are many different types of cancer. Cancer affects different organs. It affects both the patient and the caregivers and families in different ways. So I just believe I would be amiss if I just did not just recognize cancer, all types of cancers, period. So this month, as we salute warriors, as we salute caregivers, as we salute those who are currently in the battle, our conversations here in the chat room will be in general, so that anyone who is battling, anybody currently walking through a diagnosis, the caregivers, the family members, will be able to take away something. That is my prayer. We'll be able to be encouraged, your faith be ignited, your faith be renewed and restored based on the discussions that we're going to be having these next 2 weeks. And so with that said, I want to go ahead and just have a quick word of prayer and bring on my guest. And so, most gracious Father, in your precious Son's name, we just thank you for another opportunity to come on this podcast, to come before your people from throughout this nation, these United States, and all over the world to share with them regarding health, healing, and wholeness. And it is my prayer that something said here tonight in the chat room will help somebody, will bless somebody as they may be going through a health challenge, some type of crisis, and in the midst of this pandemic, that they will find hope and they will find strength based on something shared tonight. I pray for the peace of you, Father, that passes all understanding, to keep our hearts and our minds. I pray, dear Father, that, unyielding faith, trust, and hope in you. That is our portion, and that is my prayer for your people. And it's in your precious Son's name I pray. Amen. And with that said, let's get with it now. So look, real quick, are you looking to expand your reach? Do you offer a service that you would like to share on a worldwide platform? Look no further. Contact me, Nurse Coach Jean, at healthchatwithcoachjean@gmail.com for more details. And so my guest tonight, I'm so excited to have her on. She is a board-certified medical oncologist. She completed medical training at the University of Alabama School of Medicine in Birmingham and her medical oncology hematology fellowship training at the University of Chicago in Illinois. She says that being a medical oncologist was an easy decision for her because her interest in the disease biology of oncology, and in addition, she just felt drawn to that particular patient population. And so she chose healthcare because she feels nothing is more important than a person's health. And I can tell you from personal experience that she is such a caring, compassionate provider. I thank God for her, for leading me to her. She was my oncologist when I was walking through that journey, that part of my life. Her warm, sunny, caring personality radiates so much from within her that when I was going through my health challenge, yes, I dreaded going to see her because of the treatment, but I truly enjoyed conversing with her because her care and concern for her patients, as well as her smile, just made it so much more bearable. And so much so to the point that I call her Dr. Sunshine. I've been calling her that ever since. So without further ado, I introduce to some and present to others, Dr. Zhang. Dr. Zhang, are you in the virtual building tonight?
I am. Can you hear me?
I can hear you just fine. Hi, Dr. Sunshine.
Hi. That introduction actually made me a little teary. We've come full circle, haven't we?
Yes, we have. Yes, we have. And I have been very transparent with my audience since the first episode of Health Chat with Coach Jean, the first Thursday in June. So they know all about me. I'm an open book because I believe that my transparency and the reason that God allowed me to go through that is to help others. And so I've been very transparent. So, hey, let's say we're going to talk, we're going to chat, if that's okay with you.
Yeah, absolutely. I remember the first day I met you, and you're such a strong woman. And the fact that you've survived what people don't realize to be such an aggressive cancer, and to turn around and give back the way that you're giving, and to provide education in a field that causes so much fear is so important.
Yeah, I feel like, just like with my nursing career, that it's a calling. I do believe that. And so that's why I do what I do. That's why I do what I do, and that's what drives me to do what I do. But I'm just so excited to have you here in the virtual building this evening. And if you would like, if you have something else about you that you would like to share, or want our audience to know, feel free at this time to share.
Well, you went through my training. Since then, you and I met in a community practice in Georgia. Right now, I work as a medical oncologist in Dalton, Georgia, which is about an hour and 30 minutes north of Atlanta, 30 minutes south of Chattanooga. It's a wonderful place called People's Cancer Institute. When we're building a cancer center there, people are treated very well. Our focus, or my focus there, is lung cancer and lung cancer screening. which interestingly is something that you and I talked about a lot when we first met.
Right.
Right. Yeah. I guess personally speaking, I'm kind of a Southern girl at heart. I did train at Chicago, but I came back to the South to be where I feel like I belong.
Wow. And I am so grateful you did come back to the South. I tell people that, I'm very grateful to you because you and, my primary care provider back at the Army base, you listen to your patients and you dig deep. You really, really, really listen to your patients, get to know your patients. And like you said, make it a priority to identify their specific source of suffering that very first visit, because everyone's different. Everyone approaches that type of diagnosis differently. We all come from different backgrounds. And so I want to go ahead and ask you, because we know that there is a psychological, emotional, social, environmental, and spiritual aspect that accompanies that diagnosis. So I would like to begin by asking you, what is your methodology like? How do you go about really identifying your patient's individual pain points, if that makes sense?
Yeah, absolutely. I think that's a really important question. When people think about patients going to see an oncologist, they think more in terms of diagnosis and treatment. But truly, from what I've found out, what I've realized is that patients, they already have a good idea of the fact that they have something really wrong. And most actually are relieved to hear you give them a diagnosis. The most important part of that first discussion is to ask what's causing their suffering. It's ironically usually not the fact that they have breast cancer or colon cancer. It's the fact that they're dealing with anxiety or depression associated with the knowledge of knowing something's wrong but not knowing how to seek treatment or, get cured. So it's as simple as asking the patient, giving them the time and permission to express how they're suffering and not just the fact that they have this diagnosis now associated with them.
Right. Because, that's a diagnosis that, with it comes, yes, there's fear, there's anxiety, depression, fear of the unknown, right? I mean, that is huge. I know that was huge with me initially. I remember the very day that I came to your office and you told me those dreaded words, it's malignant. Immediately the fear gripped me of the unknown and, how did this happen? Why did this happen? What in the world? Like, whoa, wait, what? Especially someone who, like me, been healthy all their life, was on no medication, running, doing all the things we know to do, that we're taught to do to prevent. And then suddenly, it's like suddenly your whole life has changed or your life has been interrupted.
Yeah, absolutely.
Wow. But I like what you said, giving them permission. Could you just speak on that a little bit deeper?
So with cancer, clearly there's biological changes, but there's also hormonal changes, specifically with pancreatic cancer. And many people don't acknowledge that they're not just suffering from the cancer, but also from other things that are associated with cancer, like the most common is depression, malnutrition, inability to absorb, in the case of GI cancers. So those are the things that also need to be addressed. Those are what we call supportive management. And they're just as important as giving someone chemotherapy or hormonal therapy or immunotherapy. They all go hand in hand. So some people shun the idea of holistic approach. In my opinion, that's not, what people would think of as holistic approach. It's more of just thinking of a patient as a whole and addressing coming up with a comprehensive plan. The idea of referring a patient to a nutritionist or a physical therapist, a dietitian, those are all part of care that a patient should expect, and if they don't receive it, should demand, because they all play a part in how well they respond to treatment.
Mm-hmm. Right. And everyone doesn't come in the same. Some might have been healthy before, some have underlying health issues already. And no two people are the same. And I know for a fact give individualized care, which is what all patients deserve, right? That individualized care. And so, I talked about this briefly in an earlier episode of Health Chat with Coach Jean, but I would like you to, from your perspective and your medical expertise, to share with our audience how important is one's attitude when walking through a cancer diagnosis and a treatment, if they decide, because everybody don't decide to go to be treated. Some people, if they do decide, Western medicine with chemo or radiology, some go holistic. But regardless of the treatment modality they choose, how important is one's attitude? Because for me, that was that was top priority.
I can't express how important perspective and attitude is. In fact, in the world of oncology, we have a score that we give patient called performance status. And that performance status is used in many ways to describe between physician to physician how this patient looks, but also it gives us an idea if a patient qualifies for clinical trial. It gives us an idea if they can tolerate certain chemotherapy. And performance status is very subjective, and it's based in part in a person's attitude, the way that we describe an attitude being, are they walking, are they eating, are they functioning. So the functionality of the patient's intrinsically linked with their attitude. If they are eating and as a result they're not losing that much weight, if they're getting out and doing things and as a result they're not losing muscle mass. So clearly the emotional aspect of a patient directly affects the physical status, which then directly affects the treatment plan and if they have certain options open to them, like a clinical trial.
Oh, wow. Yeah, because I know that you're heavy into research, which to me all clinicians should be, because our practices, whether you're a medical oncologist, a physician, a nurse, should be based on the evidence. And so that's another one of the things that I appreciate about you, because you are definitely on evidence-based practice. And that's what, coming from, being a nurse and coming from that background, that's one of the things that made me more comfortable with you as an RN, because I know that you did keep up with the latest research and based your practice on evidence-based research. And so that made me more comfortable with you, outside of your sunny disposition and your bedside manner. Because to me, too, that is everything. Bedside manner, that is everything. Oh, my goodness. And so I never told you this, but at first I was critiquing you. But right off the bat, your disposition just won me over from day one, even when you were still monitoring the spot that was found initially, and, which then began to grow and led up to, everything. From day one. And so I just thank you for that. But as a nurse, and I always say it's not good to know too much. And I felt, when I was walking through that dark time in my life, that I knew was a little too much being a nurse. And so, as a nurse, I found it difficult to balance everything that was involved with my treatments. And I don't know about the radiation side, but chemo, and then I'm sure you're going to school us and say probably depending on the type of chemo. But what the regimen I went through, I had a hard time trying to balance my hydration, elimination, and my nutrition. And so, and all of that was created by the chemotherapy regimen that I was on. And I don't know if it's the same for mostly all regimens, but can you explain the importance of, maintaining this balance between these three during cancer treatment? And most importantly, why there has to be balance. There has to be balance, whether you're undergoing treatments or not. But can you just kind of delve into that a little bit for us?
Oh, yeah, absolutely. I have to say first that you are the poster child for lung screening. I mean, I don't think people realize how rare of a situation your story is, with being a small spot on your lung and us monitoring it and then diagnosing it, a few months to a year later, and it being such an aggressive cancer. You got, in my opinion, one of the toughest regimens in terms of chemotherapy, and you wouldn't have gotten through it so well if not for your positive attitude, for your commitment to what you just described as hydration, elimination, and nutrition. It's so eloquently put, but I guess that's truly how it should be viewed. When we give chemotherapy, no one wants it. It's a chemical inside the body that's not meant to be there. And the reason we give it is because we want to kill what's not supposed to be there. But as a side effect, it affects your healthy cells as well. So to support your body, when you describe as hydration, that's what we harp on during every visit. If not the physician, then the nurse or the nurse practitioner. It's always, are you drinking? Are you peeing? What color is your urine? And it's not just because we want clear urine or we're worried that you look a little, pale or dry. It's that it really affects how your chemotherapy is cleared. If you're going to get kidney disease, if you're not having enough fluid in your body. So from a biochemical standpoint, it's a very significant point to make, in a person's overall health when they're receiving treatment for cancer. In terms of nutrition, that goes into that score that I referred to, performance status. If you're not eating, if you're losing weight, you're not able to ambulate, your performance status, decreases, and it takes you out of the running for future clinical trials. We may then have to decrease your chemotherapy dose. So nutrition is so important. I know that you and I have talked about it at length, and usually the thought is that you want to increase your caloric intake and you want to decrease your sugar intake, not because sugar has been proven to feed cancer. That's quite controversial, I know, but because if you have a sugar spike, then you don't have much room, in you to get protein and calories so you can maintain and gain weight. Elimination is just as important as hydration. This clinical term for it more would be your bowel movements, whether your liver's working or not. Everything is so closely interlinked. If you're not able to have a bowel movement, it could, affect your kidneys and your liver. It definitely will give you more side effects because many chemotherapies cleared in the stool. So all of these things need to be discussed, and if not, at least for the patients to be aware that these are things that they need to keep diaries of, which is what I know you're a proponent of. So it's not just chemotherapy. It's not just, seeing the right physician. It's a lot about taking control and ownership of your own body, your own cancer, and your own treatment as you go through this process.
Yeah, you brought up two good points, actually, and let me see if I could reiterate because I'm just really listening and taking all in what you were saying, and I hope our listening audience is too. But I always say, and I base my nurse coach practice on this, the body, every organ, every cell, every tissue, every nerve, cell, fiber, every part of our body is interconnected. And so when one is out of balance, that creates an imbalance throughout the whole body. And then the other thing is that, and I have to admit, I was okay the first few months as far as eating. Well, maybe not really. Maybe the first, I just craved stuff that I normally wouldn't eat. But towards the end, like them last 3 months, that's when I started not having an appetite, and I had to force myself to eat. And then I lost my taste for the things that I would normally eat. It was crazy how that happened. But I knew that I had to maintain some form of nutrition. I had to maintain my water intake, which I was a water drinker anyway. I just had to balance between the days I was going to treatment and the days I wasn't at treatment, because y'all load folks up with a lot of fluids, at least the type of treatment I was on.
Yeah.
And so that balance was tricky, and I had to make sure I was logging and keeping, balance with that, and then making sure that I was having the bowel movements and urinating that fluid out as well. So that it's key, but it's all, our body is all interconnected, every fiber of our being. And anytime any one part of our body is out of whack, it affects and creates an imbalance throughout our body. So I'm glad that you said what you said, because it's important that people realize that.
Yeah, exactly.
Yeah. And so, now we're in the midst of this pandemic, and I thank God if I had to walk through what I went through, he timed it to where I'm not going through it now. I can't imagine now what your patients and other patients who's walking through that journey now are having to face and deal with. I would think it's increased fear now that we're in the midst of this pandemic, and now flu season is upon us. So how important is it for patients who are currently going through treatments for a cancer diagnosis? How important is it for their caregivers to understand how these pose an additional risk to them, and what they can do to try to maintain an optimal level of well-being during this time?
Right. I found that COVID and the upcoming flu season are affecting two groups of patients in a different way. The first group are patients who have already been diagnosed and are receiving chemotherapy. In our practice, they've not canceled their appointment. They've continued to, come in and remain committed to their treatment. But to your point, their chemotherapy puts them at higher risk of getting infection because their immune system's already compromised by the chemotherapy that we're administering. So CDC recommendation of hand washing, social distancing, the mask is more relevant than ever for these particular patients. For them, I would encourage them to, of course, make their appointments. It's okay if, they opt for telemedicine or televisits a few times, but nothing can compare to the physical exam and seeing your physician in person. The other group of patients I've realized have been really affected by COVID are actually the undiagnosed cancer patients. We're seeing a higher percentage of patients coming in with undiagnosed later stage cancers, which tells me or indicates that they've waited to come into the physician's office because of COVID, I would think. They're coming in with the mass that they've known for, 6 months, or, blood in their urine for months, are not able to have a bowel movement for months, when typically they would have come in sooner. These patients are already fearful as it is about the possible diagnosis of cancer, and to have COVID be in the midst of all this, it's easy to use COVID as a reason to not come in, just to say, I'm going to wait for this COVID to resolve itself. But we just don't know when that's going to happen. So if anyone's listening, and if there's one piece of message that they take away, it would be that don't postpone your screening. Don't postpone your visit to an oncologist if you feel that mass in your breast or urine in your blood or having diarrhea every day and then constipation. Get it evaluated. Don't wait for anything. You have to come in regardless of presence of flu or COVID. We take very good of our patients. In general, people get their temperature checked. Everyone's wearing a mask. Doorknobs and all the frequently touched surfaces are sanitized every hour at least. So please don't be fearful and get diagnosed earlier, because any cancer can be cured as long as they're caught early. That, I think, is the most important message, which is why screening is so important.
Yes, I'm glad that you said that, because in an early episode of Coach Jean, Health Chat with Coach Jean, that's what we talked about making sure that everybody, the listeners and people are up on their yearly exams, especially the screening exams. That is important. Important that if you feel something's not right, you're noticing something, you got to get it checked out. I am so glad that it started with me. I'm a half marathon runner. And one day at work, I'm running up the stairs, and I'm like, why am I short of breath? But the funny thing was, which ain't really funny, but for a better word, was when they found a spot on my lung, it wasn't even big enough to cause any issue.
Mm-hmm.
But that inner small voice that, people want to say something told me, look, we better get in tune and listen and go when we believe in our spirit, in our heart, that we need to take action.
Yeah.
And so, it was just, and I don't know if you remember the first thing it's funny because the day you told me that spot was malignant, I don't know if you remember that you started encouraging me in your office that day. Do you remember what you said to me?
I don't actually. What did I say?
One of the things you said to me was that, you was encouraging me and saying, look, we caught it early. What I was originally referred to you for was not even what, you ended up following me for those months prior to that day in your office. You said to me that, what did you say? You said several things to me, but one of the things that you said that really stands out, because I included it in the book. I really, really did. And, you said to me, oh, wow, I can't think of it now, but it was so profound, Dr. Zhang. You know what? You're going to make me glad. I'm going to tell you right now, because I got the Spirit of a Warrior, the book that I wrote as a result of all of this that has happened to me. I'm going to tell you right now what you said, because it is going to bug me if I don't. But you reminded me how you said something told me to keep monitoring you. That's what you said to me.
Yeah, I remember now. I almost forgot. Miss Turner, you came to see me for something completely different. You came to see me for some others. Yeah. And we saw that spot in your lung. You're absolutely right. And, it wouldn't have been wrong to not monitor it. It was so tiny. But something about it caused me to keep monitoring. We monitored it for over a year, from what I remember. It wasn't just a few months. It was a while. And
it was almost a year. It was September. September of 2017 was when I first met you, and you monitored it, and it was July 5th, the day after 4th of July of 2018, that you told me it was malignant. Yeah. That was almost a year.
And I think I remember telling you I've got really good news and really bad news.
Yeah.
Really bad news in that it's cancer, but really good news that we can get it out. We caught it so early. And that's, again, that goes to our campaign of having people really buy into the idea of screening, be it for lung cancer or for breast cancer or for colon cancer, because, and you are, again, a poster child. If we had caught it later, we'd be having a very different discussion. But the fact that we caught it so early, meaning that it was small in size, it had not spread, despite how aggressive the actual biology of this tumor was, here you are giving back and doing what you're doing. So it's so important to follow nodules, to get screened, and to see an oncologist, and not let that fear hinder you from getting diagnosed. Because time is the most important factor to how long you stay on this earth in the setting of a cancer diagnosis.
Yes. When I tell you, I thank God for you all the time. You and Doc Sloan, because she listened to me, because she'd known me. Matter of fact, we had known each other for 10 years prior, when she was a lieutenant and I was a captain, and then we ended up at the same duty station, me as a lieutenant colonel and her a major. And she said, well, I know you, and so let's do this, and this, and you want to be sent out to see somebody else for a second opinion, I'm going to write the referral and send you out. And when we say send somebody out, that means off the military installation, send them out from the military hospital to a civilian provider as yourself. And so I just thank God for y'all all, let me tell you, all the time, let me tell you. And so I just want you to know that, and I'll be forever grateful to you, the expertise and the kindness and caring spirit that you possess. And so it's the time of the show where, it's time for what I call Coach Jean's Health Tips for the Week. But I would be so honored if you, Dr. Zhang, would provide our listeners with 2 to 3 health tips for the week regarding the topic tonight.
I think in terms of health tips, I'd like to focus on screening because, in this COVID pandemic, it's so easy to wave off screening and say, I don't need to get this done. I'll wait until next year. So in terms of health tips, I would say you need your CT lung scans. So it's a CT scan of your chest. If you've had any significant history of tobacco exposure, if you've smoked for a prolonged period of time, it's always worth asking your primary care physician to consider writing that order for you so you can get that CT scan done. I can't stress how important that is, because if we catch something early, all we need to do is to surgically remove it and then declare you cancer-free, as opposed to, it declaring itself and you having symptoms and then getting it checked out. My second screening point is colonoscopies are still important. If you are having symptoms of alternating constipation and diarrhea, that's a sign to get a colonoscopy. In that case, it wouldn't be a screening colonoscopy, that would be a diagnostic colonoscopy. And then my third point would be mammograms. Mammograms have become so much more tolerable. They're not as painful as people describe them to be. There are different techniques that people use now. There's ultrasounds, mammograms, there's even MRIs of the breast. So I know many patients later retrospectively tell me that they feared it. But please, once you hit that age of 40, or if you have a family history, there is no good time, but this is the time to do it, regardless of COVID, because cancer doesn't wait, obviously. So if I needed to stress anything, it's more about prevention, because that's where improving cancer outcomes lie, is catching them early.
Right. Right. Yeah. And you know, I'm a living testimony of that. Thank God I was up on my screenings and everything. And I would even add to know your body, because
Absolutely.
when they found that spot, I mean, I just had my yearly exam that I was getting them, you know, in the Army, we get them yearly. And I just had my yearly exam that January 2017. And here it was late August, September when I got sent to you. So even in that same year. But that one little thing that had me thinking, why am I sure that? And really, again, it was so small, it shouldn't even have caused that. But that was something that was abnormal for me, getting winded and tired, running up a couple of flights of stairs. So we got to listen to our bodies, and especially those who are not at the screening ages yet, because cancer hits young people too, under 40 years young.
Right. No, I absolutely agree. I mean, you just have. No one knows your body more than you. So, I think that the key is just to trust yourself. And if you feel like you were saying, if you feel like something is off, don't be fearful. Just get it checked out. No, sometimes you may not even be able to explain it. There's so many patients of mine who have told me that they've known something has been off for a while, even years. And, some had the insight to get it evaluated, while most didn't feel like they could trust their own bodies or trust themselves to know their own bodies. So it's always hard to play the what if game, but if there's any concerns, just please get it checked out.
Yes, I concur. And so, Dr. Zhang, this my time goes so fast, and I could talk to you all evening long. But I just want to give you my sincere thanks for you taking time out of your busy schedule to join me here in the chat room and have this very important discussion. I just thank you, and I just wish continued blessings to you and your family, everything that you do, the patients that you help, and just keep smiling, keep being that ray of sunshine that you are, because it means a lot. It means a lot to me, and I know it means a lot to your patients currently under your care. So I thank you so much.
Mrs. Turner, I'm so proud to know you and to say that I know you. You've given back so much, and I'm so impressed with how well you've recovered despite how aggressive chemotherapy regimen we had you go through. I just couldn't be more proud. So thank you for having me on.
Oh, you're so welcome. And don't be a stranger.
I won't. You have my phone number.
Okay, great. I will take you up on that, and hopefully soon, when these COVID numbers go down and we feel safe going out again and socializing, we have got to go to Papa Do's. We used to talk about it all the time.
We talk about it all the time. I totally forgot about that. Yes, please.
I have it. I have not Dr. Sunshine. But thank you so much. God bless you. Thank you so much for joining me.
Thank you for having me.
Yes, ma'am. And so to you, my listening audience, you've heard from Dr. Zhang, medical oncologist and hematologist here in the chat room. So we touched on so many things tonight. We talked about not only the physical aspects of, physical sides of a cancer diagnosis and treatment, but we covered the psychological, the emotional, social, there is loneliness and isolation. But look, there's a spiritual aspect to it as well. And look, like I always say, we are body, mind, and spirit beings, okay? And so every part of our body, every organ, every tissue, every cell, every fiber is all interconnected. So I'm going to tell you right now, from a spiritual perspective, look, we all going to call on God sooner or later. So why not make it now? I mean, know him, not just know about him, but get to know him for yourself. So I invite you to welcome God into your heart, into your life. You know, it's easy. All you got to do, you got to believe. All you got to do and believe, like just say, Lord, I believe you. I believe your son died for me. I'm a sinner, but I know you can save me. And look, I welcome you into my heart, and I make your heart my home. That's it. And just believe, you all. And look, we cannot have a discussion about cancer awareness and the other sides of a cancer diagnosis and fail to acknowledge the silent partners in all of this. Who am I referring to? I'm referring to the caregivers. And so next week, I welcome you to join us here in the chat room for Warriors Walk. I offered this segment, introduced this segment back in July for an episode, Warriors Walk. This is going to be the caregiver episode next week here on Health Chat with Coach Jean, where we're going to hear from caregivers of cancer conquerors as well as those who are currently walking through that diagnosis. And so, as always, our heartfelt thanks to my producer, Mr. Jerry Royce Live, my guest tonight, Dr. Zhang, to you, my listening audience here in Atlanta, throughout the United States and the world. Thank you, those of you tuning in via Pray.com, Apple, iHeart, Spotify, and Spreaker.com. Look, until next week, if God says the same, I wish you peace and health. God bless you all, and good night.
You are listening to Jerry Royce Live Worldwide Podcast.
Thank you for joining us for another episode here in the chat room. Health Chat with Coach Jean, that is. Until next time, if God says the same, I pray peace, health, love, and well-being for you and your family. God bless you.
Can you feel the power? Can you feel the power? Feel the power of double X.
Positive Power 21.org Internet Radio.
You are listening to Jerry Royce Live Worldwide Podcast.
Hey, my name is Davis and I'm from Haiti, but I live in Dominican Republic. I'm here, Positive Power 21, Jerry Royce Live Worldwide.
Hi everybody, I'm Nina Taylor, and here is your gospel news. Worship leader and recording artist, singer, songwriter, and producer Israel Halton. He became involved full-time in worship ministry in 1989. From the start, he looked to overcome cultural and denominational barriers. With this idea as a centerpiece, Israel formed his New Breed Ministries in 1995 with his wife and a group of world-class musicians and singers. Touring extensively brought the ministry's powerful and diverse sound to churches around the U.S., while Israel's two 1997 releases, Whisper It Out Loud and Way of the World, kicked off his recording career. New